Hi, Dr. Huntington here, and in this video, we'll look at one of the most common medical conditions in the United States, and give you ways to avoid it. It's called diverticular disorder, and it's a condition of the colon that becomes, more common with age. In fact, it affects 10% of Americans over the age of 40, and 50% of people over the age of 60, and then by age 80, it's 70%. And although it looks like a disease that's caused by aging, it's really not. What it is an accumulation of damage from lifestyle choices, involving mainly poor diet and inactivity. In fact, it's entirely preventable. So let's see what we need to do to avoid being part of that 70% who end up with the condition. Now, your colon is an incredible, 4.5 feet long, right? And it's all tucked right in there, and it contains various muscles to help, move things through. And when the inner lining of the colon pushes through weakened muscular layers, it forms these sac-like pouches called diverticula, and I'll show you what they look like here. So here's a colon, and you can get these pouches. These are the diverticula. And they form, you can get lots of them. And, and these generally don't cause any symptoms. The condition is called diverticulosis. But when intestinal material, full of bacteria, gets trapped in these pouches, it actually causes inflammation. So you get this, this stuff gets stuck in here, right? And then the inflammation can occur. It's a more serious condition that's actually called diverticulitis because of the inflammation. Now, when the bacteria gets caught in there, it can actually, cause an infection, and other actually life-threatening complications, which usually require treatment with antibiotics or surgery. With that kind of treatment, of course, comes, more risks for complications. Now, symptoms of diverticulitis include things like abdominal pain and fever, nausea, constipation and diarrhea, or bloody stool. Now, the key here, is really to avoid forming the diverticula in the first place, right? And that comes with maintaining a proper diet and getting regular exercise. Diverticular disease was really rare 100 years ago, because diets contained more fiber and, hardly any processed or refined carbohydrates. Today's diet of sugary foods and unhealthy fats and, too many grains are really the reason so many people suffer from low-grade inflammation throughout their body. And if you fall into that group, the inflammation deteriorates the integrity, of your gut and drives digestive problems like constipation and diarrhea, harmful bacteria overgrowth, and encourages these diverticula to form, these little pouches. So the solution, to a healthy colon is, to eat plenty of fiber, mainly eating, lots of vegetables, and drinking, enough water to maintain hydration. This will help also to reduce your risk for things like hernias and hemorrhoids and varicose veins. Remember, fiber is fuel, for the good bacteria in your body, and that bacteria fights inflammation and protects your gut and your immune system and your brain, which further helps you to steer clear of things like, cancer and diabetes and heart disease. Now, good sources of fiber include things like avocado and broccoli and Brussels sprouts and cauliflower and artichokes, berries and coconut, as well as chia seeds and almonds. Those are some of the best sources. Now, another culprit of diverticular disorder is, chronic use of NSAIDs, that increase intestinal inflammation. And NSAIDs, they're the non-steroidal anti-inflammatory drugs, right? Things like ibuprofen, and so that's, one of the reasons to, use natural remedies whenever possible, so that you avoid that risk factor that comes along with the NSAIDs. Now, exercising regularly is also key to a healthy colon, because exercise supports digestion and normal elimination and a healthy weight. In fact, research has shown a strong link between diverticular disease and obesity. The good news is that, eating an anti-inflammatory diet and staying active, will make it much easier for you to maintain a normal, healthy weight. All right, so let's get going on that anti-inflammatory diet. And if you don't already have a regular exercise routine in, now's a good time to start. Okay, so if you're not already subscribed to my channel, just click below to subscribe, and I'll make sure to send you lots of great content.